Thank you so much for bringing Bub in for his 12-month well-child checkup. Physically, he's doing great and meeting all his milestones. I'm glad to see that he is so healthy. He is a big boy. Mom, you're doing a really great job and I'm proud of you. Now we're going to talk about what we should expect to see physically, socially, and developmentally over the next several months. I'm going to go ahead and address some issues normally discussed at the 12-month visit as well as the 15-month visit. We're going to talk about Bub's health and safety as well as address some social concerns. To begin, I would like to address any concerns that you may have. We will also talk about any factors that may affect Bub's health. We want to talk about establishing routines, nutrition, establishing a dental home, communication, and social development, temperament, discipline, and safety, just to name a few. Feel free to ask any questions that arise. I'm happy to address your concerns. I'm going to talk about a lot of things, so please stop me if I need to explain something more thoroughly. I will also be sending you home with some handouts of what we have discussed today. So, Mom, do you have any concerns about Bub that I can go ahead and address? Okay, I'm glad to hear that. The Academy of Pediatrics recommends that we assess social determinants of health at every visit. Do you feel like you have the resources necessary to ensure adequate nutrition, access to health care, and other needs for Bub? I'm glad to know that you feel that you're financially able to care for Bub. Please know that should your situation change, we can give you a list of resources to consider. Give us a call. We would be happy to give that information to you. Now we're going to talk about safety. The CDC states that the top 2 causes of unintentional death in children ages 1 to 4 is drowning and other injuries. The CDC states that 3 children die every day as a result of drowning. In fact, drowning kills more children aged 1 to 4 than anything else except birth defects. So never leave Bub in a bathtub alone. It only takes a little water to drown, and it can happen quickly. Be sure to watch him closely anytime he is in or near water. Please keep Bub in a rear-facing car seat as long as possible. When he outgrows the rear-facing car seat, he will travel in a forward-facing car seat with a harness. He will then progress to a booster seat and then a seat belt when the seat belt fits him properly. The CDC states that nearly 150 children between the ages of 0 and 19 are treated in emergency departments for injuries sustained in motor vehicle accidents. Being in a car seat gives Bub added protection should you be in a car accident. Burns are common during toddlerhood. It is important to have a smoke-free home, have working smoke alarms in every room, have an escape plan, and ensure that your hot water heater is below 120 degrees. The CDC also notes poisoning as a leading cause of injury and death in toddlers. Everyday items in your home can be poisonous. Keep all medications, chemicals, and other toxic items locked away. I've written the number for the Nationwide Poison Control Center on Bub's discharge summary. Keep that on your refrigerator and in your phone. As you know, choking is also a big concern. Toddlers like to put toys and things in their mouth. Food can also be a choking hazard. The CDC recommends that your child should always sit upright when eating. Bub should never eat in the car or stroller, and food should be prepared in a way that is age appropriate. Bub's play area should be safe and free from cords and small objects he could put into his mouth. I always suggest getting down on your hands and knees so that you can get a good look at what he is able to see. Do you have any questions for me now about keeping Bub safe? Okay, we'll go on. Now we're going to talk about Bub's health. The American Academy of Pediatrics recommends that Bub be weaned from the bottle by 18 months to decrease the risk of drinking too much milk and tooth decay. We recommend that you begin weaning him from the bottle to using a training cup. According to the CDC, you can also go ahead and switch from breast milk or formula to 2% or skim milk. They also recommend avoiding or limiting fruit juice to no more than 4 ounces. Be careful of junk food and offer healthy meals and snacks. It's also an appropriate time to locate a pediatric dentist. I will include a list of local pediatric dentists who are taking new patients. Do you have any questions for me now about Bub's health or nutrition? Okay, we'll go on. Finally, I want to discuss some social concerns. The CDC has some great recommendations for building structure and keeping routines. Toddlerhood is often a difficult time. They are growing rapidly and often into everything. It is important to establish routines around meals, sleep, and bedtime. Be sure that Bub knows the rules so that he can follow them. Use consequences, both positive and negative, to give Bub feedback. An example of a positive consequence is using praise to let him know he has done a good job. An example of a negative consequence might be a timeout or removal from the situation when the rule is broken. I want to encourage you to enjoy Bub. He is a great kid. Spend quality time with him, reading to him, and talking to him. It helps build positive relationships. I know I have covered a lot of information. I just wanted to give you some details as to what to expect in the upcoming months. Be prepared to watch him continue to grow and learn. During this age, they learn something new almost every day. Do you have any questions for me? Okay, we'll go on. Thank you for letting me care for Bub. It is truly an honor and a privilege. The nurse will be in to give him the recommended immunizations in just a few minutes. Please make an appointment to return in 3 months for his next well child checkup and immunizations if necessary. Thank you and have a good day.